snatched brow. Right now we have a couple threads inside my patient's forehead, and this is going to lift her brow. If you see one side already having more of that angled straight look versus the arched curve, some people call this a cat eye or a fox eye. It's typically called a fox eye when we pull a little bit more from this side. And we are putting these PDO threads, these will dissolve over the course of a 6-month time period, building collagen and lifting this area. I am going to secure, we've finished this side, and I wanted you guys to see as we're doing this, we're gonna secure this one. Will you watch the hair? Perfect. Hold on. We're gonna secure this one in there. Look at the difference between the one side. I'm actually gonna show her in a second. We're gonna do this in the hairline so no one can see. The only negative to that is you don't want to catch any of these little hairs. This inside. Perfect. Okay. Now, I've been doing this for over 10 years, so let me tell you something. No one cared about this 10 years ago. I was doing it because of out of my mind. Now, all the girls want a snatched brow. Let me show her really quickly. Take a look really quick. I want you to see the one side versus the other. You see the difference?
Yeah.
So it's pulled, and look at the brow, look at the lid.
Yeah.
Right now it's also swollen, and she can't really move him because there's numbing in here. But now we're gonna go on this side and lift it this way as well, so we can get it to be more even. There are 2 threads here and 4 threads here, 6 threads that are grabbed onto the skin, hooked in there, pulling this up. So right now she's not gonna even see the benefit of it yet. It is going to improve over the next few months. But it looks great and almost no bruising. Literally, you're going to go out tonight. I just don't want you moving around and laughing too much because you don't want the threads to move. So I'm going to show you guys a little bit of, I'm going to come from this side, so keep your eyes closed again. Oh, who's doing that?
Is that me?
Don't do that.
Did I hit that?
Yep, be careful. So I'm going to show you guys again a little bit of the kind of fox eye look. We're going to come from this angle. We're going to use a little bit of a longer thread. Go ahead. Pause. We're going to go in there. Perfect. There we go. Take a look. Don't try this at home. Okay, but you see how we already got it to lift. Hold this for 1 second. Trying to secure where I want it to go. There we go. Okay. And the anchors that are on side and side, if you see, look at the thread. You see how all these little dots on there? You see the little dots? Yeah, you can see it really good there. Those are all little barbs. Okay, keep your eyes closed. I don't want the thread to bump into your eye. Perfect. Okay, now we're going to secure. And I'll show you guys what the anchor thread is going to look like. What are they saying over there?
People are more amazed than anything. We're not getting questions. They're wondering what we are doing.
So tell them.
We are doing threads right now. These will lift her brows, give her a nice snatched
show you
brow
guys
look.
straight now. Take a look. You see the difference? Obviously, there's a little pinching that's here. That's going to go down a little bit. Perfect.
These anchor in her skin.
Now, some people will actually put a little piece of tape and hold it here for like a week. But it doesn't really do that much, and I want her to be able to go out.
Is it painful? Can we ask our patient? Is she in pain?
No, she's got nerve blocks. How do you feel?
Nothing.
Okay. So again, that little knob there is okay. Perfect. So we're gonna come in.
Is
with
this
another
called
angle.
brow plexi?
So, I mean, that's a real surgery. This is a non-invasive option. Now we're gonna use a little bit of a smaller thread. It's the same size, but a little bit shorter. Go ahead and grab there. There's always little blood vessels around here, so we're just really cautious.
How is the thread stuck in her face?
How? It embeds inside, see? And it grabs onto the skin and it pulls it back.
So cool.
Now, what happens if you wouldn't know how to do this and you did it incorrect? You could get lumps and bumps. You could get track marks where you can actually see the thread for multiple months.
How long does this last?
This will last 6 to 12 months, but honestly, most of the girls do this yearly. And they get tightening and they get collagen production and they're happy. My goal is to get her that little bit. Oh my God, it looks really good. That little bit that builds over time as well. And then I'm gonna do my secret weapon. Oh, now they're perfect. You can see them. The heights are the same. We're gonna do my secret weapon by pulling an additional angle at the top, up in the hairline. So I always tell people this is a little bit harder to do.
Are these
because
dissolving?
These are dissolved. You have PDOs. And it's a little bit harder to do because we're in the hairline and it's a thinner skin area. Perfect, that's fine.
We have two of our favorite questions right now.
How
I've been
much
asked
is
multiple
it?
times. Yes, how much is it?
So this
And how
range is-
painful?
Well, she's in zero pain.
And if they want to know how much it is, they need to book a consultation with us, correct, Dr. Emer?
Yeah, I mean, I always tell people threads typically range about 1,000 to 2,000 per area. So it depends on the number of threads and what threads we're using. Look at that. Look at that security. I lifted it up because this side was lower than her other side. So I'm securing that pretty tight here. And again, we're gonna secure this in the hair. So what do we wanna do? We're gonna avoid, there we go, perfect. Oh, perfection while we're on live. It's amazing. So I'll show you guys in a second.
Multiple people have joined right now. They're asking, what is she getting done? She's getting PDO threads right now to lift her brows.
Just move the hair here. So hold on. Just gonna move some of the hairs. Now I'm nice. I don't like to cut the hair.
Someone
Some
said,
people will do it.
I don't see any change. That's because we just did this side previously. If you
Oh
do
my
stay tuned, we
God.
will post her befores
I'm
and her
telling you,
afters.
years ago, all it was a static before and after. Maybe you even had one. Then it was a image. Then it was a video. Now it's like if you don't see the result in 1 second, it doesn't work. I'm like, that is not how cosmetics works. And remember, this is an enhancement procedure. This is not a change your whole life procedure. There we go. So now if we take a look, let me take a look from the front and make sure. Oh yeah. That's really
Beautiful.
good. So you guys see we have my security thread, which is right here. And then my cat eye fox brow threads over here, which I can definitely feel are very tight. Let me show her. We'll
Someone
do
said,
a
how is
little-
she smiling in pain? She might even smile right now.
Got a little lift. So right now she's not going to notice too much, but what you should notice is a lot more opening here and a lot more lifting here. What do you think?
Yeah.
Plus also tight. It's just much tighter. There's a lot of anchors in there, you know, but it's going to do great. And did you feel much pain even from that?
Not at all.
What do you think? Come on in, Lindsay, skincare
Hello.
specialist.
Hi.
No, don't let her laugh too much. I don't want it
no
to
laughing
move.
aloud.
But,
Oh
but
my gosh! Look at right here.
I know.
That's
So,
exactly what we were talking about.
you know, there's a lot of people are doing, I don't want to pull too tight, they're doing this really tight look over here. It doesn't really look that natural. So if we want to keep her looking a little more sculpted, more eye opened and more natural, this is more of the look that I go for. A little bit more laterally, a little more elevated elevation in the superior lateral 1/3 of the brow. So we call that the gull wing look, like the edge of a bird. So what are they saying? Anything else?
A lot about wanting to see her befores.
Well,
A lot about
She
wanting to
just
see her
did
befores.
her.
She just did it. We will post that for you guys. Don't worry.
all right, don't let her laugh
have
too much.
those.
So
Okay.
that's PDO, brow lifting, minimal pain, minimal downtime. You could keep building on it too. You could do another treatment in 2 to 4 weeks. This is an amazing result. She did great.
Do you need to come back to have those removed?
No, these dissolve inside and they keep pulling it up. So over time, you're gonna need less and less.
Has
It's
she
gonna be
been given any anesthesia?
No, she's smiling. She's ready to go out tonight.
She's not allowed to smile,
She's
but
local anesthesia with injection.
what is
That's
the any downtime for her? She's ready to go out, correct?
Not really. I just want her to be careful with movement in this area for a week. Some people will actually put a little tape right here and actually secure this up so that it holds the threads. I just tell people you gotta live your life. So we leave it and you relax.
Someone said, "Come to New York, please."
We're gonna be there, you guys. May 5th to 10th. I'm thinking of something else. May 5th to 10th. Make your appointment now because we're pretty much booked. Appointments at jasonmrmd.com. Do your virtual consult now. With your treatment, we're there.
Tell
Right.
me, email me.
All right, now she's gonna say
Email
name
Lindsay.
here.
Email me.
Email Lindsay at jasonmrmd.com.
We'll get you set up.
She'll get you set up, and
More
we're gonna put her
questions?
under a red light right now. But do a little pan of her brow because it's perfect.
Is it possible to have fox eyes, Lindsay?
Is it possible to what?
To have the fox eyes with these.
Well, that's what we just did. That's what she's got. Go back, watch the video.
Go back once we post
Go
this.
back and watch the video when we post it. Bye, guys.
Bye, bye.
It's so funny. It's so funny that people ask. What